My name is Dr. Rob Ririe. I'm a dentist here at Boise Integrative Dentistry. I wanted to share with you today a little bit about infant tongue tie and lip tie releases. Sometimes we'll get some stumbling blocks where a mom may not have an opportunity to nurse as well as she can, and there's usually things about the baby that is struggling, like not allowing the baby to gain weight. A lot of times you'll take your baby to a pediatrician after they're born, and he can evaluate them and treat them, and they can start looking for things that might be preventing that baby from receiving nutrition. They may then start looking for other things like tongue ties and lip ties. These are things in the mouth that control and manipulate what the tongue can do and what the lip can do while nursing. And those attachments we called frenum attachments. The tongue is held down sometimes by that attachment, and same with the lip. If we can go in and release those frenum attachments, we can oftentimes allow the tongue to go where it needs to go. And so the lactation specialist and the pediatrician can oftentimes send you to us, where we can then, with certain protocols and different equipment, we can help release the attachments or tongue and lip ties. Once you come to our office and you're referred here, we have an opportunity to sit down and have a consultation with you and your baby. We can then evaluate the tongue and the lip and other parts of the mouth to determine if it's necessary that we need and could release those ties. After the consultation and we agree to have the surgery, we'll have you help us swallow your baby. And at that time, I'll apply a topical anesthetic. Soon after you comforted the baby, we'll take your baby back to the surgical area where we use a CO2 laser to perform the surgery. That surgery will be fairly quick, and we will take pre and post-op photos so you can see the images before and after, and we can communicate that information to your physician and your lactation specialist. Following the surgery, we'll bring the baby back to you where you'll have a chance to nurse and feed the baby.
So when our son was born, I actually asked the pediatrician in the hospital to check for a tongue tie because I had heard that it was something that was very common. They examined Rip and said that they saw nothing, and so I didn't assume that there would be any issues. About 3 weeks later, I was still having pain when breastfeeding, which I had heard also should not be painful by the 3rd week. So I reached out to a lactation consultant and discovered both a tongue and a lip tie. Said it was relatively severe and was likely causing the pain with breastfeeding. So we decided to also have our pediatrician take a look, as well as our chiropractor. All three actually confirmed both the tongue and the lip tie and referred us here to Dr. Ririe. We came, had a wonderful consultation, and he took Rip back with the best care ever, and took great care of him during the procedure as well. Within 3 weeks, he was fully healed. I had no more pain with breastfeeding. He's still gaining weight and doing great. And we have had just a wonderful experience here with Dr. Ririe.
We have found in a very short period of time, baby after baby having an opportunity to change their life. They're nursing better, they're growing better, and I believe that their challenges moving forward in their life, from speech, from communication to sleep and other avenues that they will have to fight and go through in their life, will be drastically improved because of this surgery. If there is an opportunity where you find and experience that a tongue or a lip tie could be involved in the difficulties that you're having, we would love to have you in our practice where we can evaluate that, consult with you, and do the treatment, and see hopefully amazing results that will come from that surgery here in our office.